Sue hit on was so all you hear is yelling and screaming and fighting, and people who have no clue about medicine directing the national discourse. And when it became apparent that what they call Obamacare or affordable care, I call accountable care, started making itself more known, I said, well, I've been at Valley Regional Hospital for the last 11 years before coming up here, and I've always tried to treat my patients like I want my family to be treated, and it was I wasn't able to kind of put a model to it, but it's easy to get kind of caught up in like a hamster on a wheel, just doing more and more, and kind of losing sense of how you're going to deliver that care. So in this Accountable Care Act, Affordable Care Act came down and said, how can I, as a solo practitioner, have some kind of impact on how we deliver care on the community basis? And I went to a meeting in Washington that was saying shifting from fee-for-service to value-based. So fee-for-service is what we're in now, and we get paid no matter what. So whether I do a great total knee or a shoddy total knee, I'm going to get paid, and that's not right. So I think the basis of what the Accountable Care Act is trying to do is say we spend so much money in this country on medicine. We need to be accountable. We need the outcomes to be good. So I went to this meeting saying, what can I grab out of it? And there's a guy, Tony DeGioia, who's out in Pittsburgh, who started this patient and family-centered care model for orthopedics, and he didn't say it, but he may have stolen it from centering. So the centering is, they're way ahead of the obstetrics is way ahead of orthopedics. I'm shocked. In taking care of patients and families. I'm really shocked about that. But, and it just made sense. It's like a light bulb went off to say, this is how we do it. How do you do it? You just view the whole experience through the patient's eyes. So you just, take it from step one to the end and say, what are you experiencing? So when Dr. DeGioia thought he was the bee's knees and the cat's meow doing joints, he's been doing them, and he thought he was going to have to just tweak a thing or two here or there. So he put a camera in the patient's rooms so he could see what was going on following a total knee surgery. So I'm just going to throw it out there because it astounded me. So from the time you get out of the OR until the next day, maybe 24 hours later, how many times do you think somebody would come into the room, to a patient's room? Any guess?
3.
So
24.
So he found that 86 times. He was shocked. He was like, how can anybody sleep? How can the light is on and people are coming in? What are they doing, a polka? So he was shocked. So he really broke it down and say, how, I gotta follow these people along the whole line, because if it's like this in this one spot, what is it like everywhere else? And so part of the way that we are going to get paid is, in this value-based system, is outcomes over cost. But part of the outcome is how you, the patient, feels about his experience. So there's this patient satisfaction survey that's called an HCAP, and now they have it mostly for inpatients, but it asks you, did the nurse help you with your pain? Did the doctor tell you what was going on? Did you feel like all of these are just how you're experiencing your care, and that is part of the patient outcome equation on how we're going to get paid. So what he started, and what we are doing now, is you shadow the patient. You send somebody along with the patient through the process, and it's been it's been invaluable to him, but it's been invaluable to us just starting it now. So we have been fortunate enough to connect with Franklin Pierce and have their physician's assistant students follow our patients. So in our clinic, we've had 25 times people have been followed just through the experience of coming through our clinic. And right off the bat, every single person complained about our waiting area. So the waiting area was just redone. It's brand new. It's got beautiful paint. It's got a nice fake Monet up on it. It looks beautiful. Our person who welcomes you is unbelievably nice and welcoming, but they can't stand that. So we learned that right off the bat, and we're going to change it. And it's little things or big things, but we have to look at it through the patient's view. And that's how, number one, we're going to make you happier. Number two, we're going to see it through you. We're going to get better outcomes because we're going to be able to see it through your view. But we're also going to be able to become more efficient for us. It's going to help us take care of you in a much more efficient manner. So that's how I want to greet this huge challenge through my patients' eyes, for my patients. And fortunately, again, Sue was kind enough to welcome that challenge. So if you come to my office, and you may well have somebody on your elbow, complain. We want to hear about it. But if it's good, say it's good. But this is how we're going to learn, and this is how we're all going to go through the process together.